Hello, I'm Dr. Melissa Merrick, President and CEO of Prevent Child Abuse America. I'm also a mother of two. Parenting is challenging even during the best of times, and the COVID-19 pandemic has shifted our world radically and rapidly into a place of great uncertainty. Circumstances that increase parental stress and anxiety, loss of income, food and housing instability, social disconnection, and limited or non-existent access to quality health care are more acute now than even just a month ago. What's more, not all children and families are experiencing the pandemic in the same way. These stressors disproportionately impact under-resourced communities and people of color. I don't have all the answers, but I can tell you that all parents want what's best for their children, and we are all trying to be the very best parents we can be in this time of crisis, even if it doesn't always feel like we're succeeding. For parents who need just a little extra help, Prevent Child Abuse America is here. For example, Healthy Families America, our signature home visiting program, has been a lifeline for tens of thousands of families during the coronavirus outbreak. The vast majority of our nearly 600 sites across the country started conducting virtual home visits before many states issued shelter-in-place orders, and we continue to provide regular assistance to families via phone and video. This enables us to maintain consistent connections with new and expectant parents and provide the sustained support they need to care for a new child, as well as to cope with the stress and anxiety brought on unexpectedly by the coronavirus. One mom shared how much better she felt after seeing and talking with her home visitor on FaceTime. And I've heard of the many smiling faces of children and adults alike as a family support worker in Maryland read aloud Brown Bear, during a virtual story time. Our nationwide state chapter network is rising to the challenge too. Prevent Child Abuse chapters in Michigan, North Carolina, and other states have developed and widely distributed useful guides for parents, caregivers, and educators in response to COVID-19. And our policy and research teams continue to collaborate with child advocacy organizations across the U.S. to ensure that stimulus measures include substantial increases in federal funding for locally driven prevention services and programs in all 50 states. These include parent support programs, baby pantries, distribution of food and medication, family resource centers, child care, and domestic violence, mental health, and substance use services, among others. These efforts to stop child abuse and neglect before it occurs are what we mean when we talk about shifting to upstream prevention solutions and taking a public health approach to the problem. They're very similar to some of the public health solutions being employed to curb the spread of COVID-19, such as wearing a mask and practicing physical distancing, creating conditions that disallow the virus to take hold in the first place. In both instances, we're seeing what it means to act collectively to protect everyone, because the truth is, it takes all of us together to make a difference. So what can you do to help prevent child abuse and neglect? Reach out. Reach out to your nearby Prevent Child Abuse state chapter and your local Healthy Families America site for assistance. You can find their locations by visiting the websites shown on the screen. And reach out to one another in whatever ways you comfortably and safely can. Social distancing must not mean social disconnection. In fact, social and emotional connectedness are more important now than ever. These are some of the most important protective factors for preventing child abuse and neglect. Additionally, be patient with yourself and others and show compassion. If you can, buy groceries for an elderly neighbor. Post encouraging messages in your window for children and families who might walk by. and support local restaurants. Thank your mail carriers, store clerks, delivery people, and our healthcare heroes. At the end of the day, it's kindness and hope that will see us through. Together, we can prevent child abuse, America, because childhood lasts a lifetime.